Speech and language impairment are problems in communication such as oral motor function. Language and communication is so important in a child's life that it can have an effect on all aspects of their life, which causes the child to feel so isolated from their peers and the classroom. In the image below, it shows speech impairment characteristics, which are articulation disorders, fluency disorders, and voice disorders. Articulation disorders are errors in production of speech sounds. These articulation errors may be related to anatomical or physiological limitations in the skeletal or muscular speech production. Fluency disorders are difficulties with the rhythm and timing of speech. Fluency is the interruption in the flow of speaking, such as rate, rhythm, repetition of sounds, words, and phrases. The most common fluency disorder is stuttering. Stuttering normally happens in the beginning of words. It's a verbal word block. Cluttering is another type of fluency disorder, where a child may talk too fast and it interferes with the flow of the child's speech. A voice disorder are problems with the quality or use of one's voice, which result in disorder of the larynx. A type of language disorder is apraxia of speech, and where the child has an impairment to select the positioning of speech muscles to produce sounds. All these types of speech and language disorders can be helped by the teacher using different techniques in the classroom where they have pictures of animals or objects where the child can practice sounding out the words. Other ways the teacher could help would be to send the child to a speech and language pathologist a few days a week so that the child can practice and play different games where it improves their speech. This way, both the teacher and pathologists are keeping track of the child's improvement and where their weaknesses are. During this time, the teacher will assess the child and have a family-directed assessment. This is where the teacher, parent, and child come together to discuss what they have been working on in the classroom and how much the child has improved. It's important to do this so that the parent feels comfortable and secure knowing their child is getting the best treatment. Whatever troubles their kid is having, they can work on at home.
It's always much more difficult for students who have speech and language impairments to learn new material. It's important for teachers to know their students. That's why reviewing over the specific student's case history is essential. Knowing their gender, age, whether they have natural or adoptive parents, and their family status information is well needed. When dealing with students who have speech and language impairments, it is a necessity that you assess the student. This makes it easier to manage their disorder. The purpose is to gain insight into his or her functional abilities. Difficulty producing sound, problems comprehending, and difficulty using spoken word are signs of speech and language impairments. This chart shows that children between the age range of 5 to 6 has the highest percentage of speech and language impairments. This rate is pretty high, but teachers are working to overcome this.
Resources and technology are important to students with speech and language impairments. This allows teachers to apply technology to their lesson plans to increase the students' success and cater to their disability needs. Assistive technology is available to help individuals with various types of disability, from cognitive problems to physical impairments. Assistive technology has devices and software to assist students with disability. In addition, students with a learning disability often experience greater success when they have an opportunity to use their strength to work around their challenges. Assistive technology tools combine the most finest of these practices. This also helps teachers personalize their lesson plans to enhance each child. Technology can give multiple access to learning opportunities previously closer to them. Teachers need to respond to the students in a positive manner because their impact affects the students' motivation, progress, and success. Engaging respectfully to students allows them to build relationship with one another. Responding to a student in a healthy way will enable them to freely express themselves in a creative way.
language can drastically affect a student's ability to learn in many ways. In order to ensure adequate teaching and support is provided for the child, it's important to take advantage of teaching strategies. When a student is in your classroom, it is important to pay attention to how he or she is responding to the way you are communicating information. It's a duty of the teacher to make sure they are aware when a student is not properly responding. Teachers can identify certain warning signs that students display when they could possibly have a speech and/or language impairment. Some warning signs may be limited vocabulary and incorrect grammar usage, where a student doesn't communicate with much word variety. Some other warning signs include difficulty in formulating questions and following directions. It also may reduce the ability for a child to understand humor. When warning signs are noticed, strategies may be implemented. One strategy is seeing a child's speech pathologist. Another strategy is keeping track of a student's strengths and weaknesses. This is necessary because it's important to know where a student is at in their growth and learning. Another strategy is patience and positive reinforcement. This motivates a child and can help with the overall growth. Another strategy is having a student sit in the front of the classroom and make sure directions are clear. And lastly, you can implement assistive technology in order to ensure that the student has all the resources they may need.